That's a low hanging fruit, but I'm the same way. I have trouble with that. I would say I would argue to if you were my client, and you asked the same question, how do I become the elite in that age category in 20 years? Like, how do I make sure I don't break a hip, and then, really increase my mortality? I would say the two things would be protein intake, which is incredibly important, and resistance training. And those are the two things that are going to create the longevity, right? Because when we talk about risks as we get older, it's really falls and the mortality associated with that. Um, and then the lack of mobility that surely follows. Maintaining mobility, that and so also building that muscle starts wherever you're at, right? Wherever you're at. If you're 12 years old or you're 60 and you've never worked out a day in your life, like that starts now because the foundation is built today. And so I would say pounding in that muscle, building in that muscle as much as possible. That means protein and resistance training. That's going to give you the best chance at, keeping that mobility as you get older. I quite quickly wanted to comment on, testosterone replacement therapy, right? It's not for everyone. It's not without risks. There are some potential side effects, things like that. Bodybuilders, though, for reference, they're on super physiologic dosing, right? They're not on physiologic dosing, so you really shouldn't be. Oh, I'm like gonna be like Arnold. No, we won't dose you like Arnold, um, or a bodybuilder. But really, my focus with taking a medication like that is really on treating symptoms, because to me, above everything else is quality of life. Not necessarily above everything else, right? Like I'm gonna of course take risks into account, but quality of life is incredibly important for me. And if you're suffering in your 30s, you're not performing in the bedroom. You don't have that desire. If you can't even muster the energy to go to the gym, long term, that's not going to be helpful to you, right? That's going to be a detriment to you. And so I have that serious conversation. Okay, if I start on testosterone, will I be on it for life? Maybe. Will I have side effects? Possibly. We can work with the side effects. But where are you at now? What are your symptoms right now? And the only way to solve that might be with replacement. Now there are other medications like Clomid and HCG, and so it's not just necessarily testosterone, but testosterone might be the option depending on the patient. So that's kind of where I'm at. Quality of life and symptoms is usually where I tend to center and gravitate myself towards when I'm considering treatment options for a client.
Yeah, and that's what I underscore with my students is it is a conversation to have with your physician or your PA in your case, to make sure that, you actually need it and you're getting the right dose. It's not just, a matter of, and there are a lot of clinics out there that you can just go in and they're going to automatically prescribe, testosterone to you, give you, a couple of vials and some needles and say, go on your way. And they're not really testing for whether you need it, whether it's being beneficial, whether it's being effective for you. And so I really caution, my students to understand that it is something that can be very helpful to individuals, not helpful to everybody. Again, it goes back to that individualized medicine.
Absolutely. Absolutely. And to that point, it's important to get the right labs as well in the right cadence. So we always get labs a couple months after initiating treatment, but it should always include a total testosterone, a free testosterone, SHBG or sex hormone binding globulin. It should include estradiol. We always get a thyroid panel as well, because thyroid could always be playing a role. There could be autoimmune disease at play, which could be masking things. So, it's important to do it responsibly. And you're absolutely right. There are clinics out there that are just pumping testosterone and then not paying attention to their patients. And that's a shame, but that's kind of an inevitability. And so anyone looking out for, these type of services, just be careful.